First up, some much-needed hopeful news. The head of the CDC is predicting the death toll could be much lower than the 200,000 prediction we heard last week because so many people are staying home. Governor Charlie Baker also announced today that the state is putting $800 million into local hospitals, nursing homes, and other health care providers to help fight coronavirus. And the FDA has reportedly approved trials at 3 local hospitals of a Japanese flu drug that could treat the virus. According to the Boston Globe, they're Mass General, Brigham and Women's, and UMass Memorial. Unfortunately, that's about all the good news I have for you at the moment, because as the death toll tops 12,000 across the U.S. and 356 here in Massachusetts, the very next story in the Globe is about how state public health officials just put out guidelines on how to ration ventilators and ICU beds if it comes to that, with preference given to medical personnel and those most likely to survive. So while all our collective attention should be focused on getting this virus under control and saving as many lives as possible, remarkably, White House politicking is carrying on stronger than ever. Just today, the president removed the inspector general who was supposed to oversee the coronavirus stimulus bill spending, just days after announcing he was pulling the inspector general of the Intelligence Committee.
He did a terrible job, absolutely terrible. He took a whistleblower report, which turned out to be a fake report. It was fake. It was totally wrong. It was about my conversation with the president of Ukraine. He took a fake report and he brought it to Congress.
Independent oversight at its best. Speaking of which, the acting Secretary of the Navy, Thomas Modly, resigned today due to the fallout from his firing the commander of the USS Theodore Roosevelt and calling him stupid and naive for sending a memo to a large group of people warning about coronavirus fast spreading through his ship. CNN reports more than 230 of those sailors have since tested positive, including the former commander. But before his resignation, Modly was clearly performing for an audience of one, the man who was downplaying the virus when that memo first came out, Donald Trump. Oh, and this woman announced today she's leaving her post, too. That would be White House Press Secretary Stephanie Grisham. But if you don't recognize her, don't worry. It's only because she hasn't held a single press briefing in her 8 months on the job. But to get back to the issue at hand, I'm joined by the former head of Medicare and Medicaid for Barack Obama. That is Dr. Donald Berwick. Doctor, it's great to see you. Thank you so much for your time.
Delighted to be here.
I know you've been critical of Trump's handling of this whole nightmare. What do you consider the most egregious or perhaps deadly mistake that this president has made?
Well, there's a very well-developed framework for leadership in times of crisis, medical crises like these, and he's violated about every rule. We need calm and consistency. We need clarity of messaging. We need a combination of absolute honesty, telling the facts, and hope. And in this particular case, we need honoring of science so that we do the right thing scientifically to protect the public. And in every one of those elements, this president has failed.
You know, you wrote a piece earlier this year in the Journal of the American Medical Association talking about our lack of preparedness for the threats of the 21st century. But the reality is we've been moving in the wrong direction on public health preparedness long before Donald Trump, have we not?
There's a long history of weakness in our public health infrastructure, which has been called out many, many times, but we haven't had the will to really invest in infrastructure at the level we need. The paper you're talking about was a summary of expert consultations in 2019 in the National Academy of Medicine, hundreds of experts involved in studying how we could respond to a 21st century threat or a pandemic. Coronavirus wasn't on our screen at that time, but other things like it were. And the findings were quite shocking. We don't have the infrastructure in public health or the habits of cooperation and supply chain management and solidarity that we need. Luckily, the private sector is stepping up right now in the absence of federal leadership to really come together, and it's quite moving to see that happen. But we're getting by the skin of our teeth if at all, and if we've got to learn from this. If you're not prepared for public health emergencies, you get hurt bad.
Can we speak about the science again for a minute, which I think you're not alone in suggesting the president is not very warm to? Unlike many people who he's picked for important positions who have absolutely no qualifications to do what they were selected to oversee, most people think Drs. Fauci and Birx are at the top of their games. One, do you agree with that? And two, do you think they've tread the line well between letting the public know what they need to know and being respectful enough of the president so that they don't end up on the unemployment line?
I think they're being quite courageous and consistent, and Dr. Fauci especially is probably the pinnacle of the world in scientific expertise, quite relevant to this. And the sciences he doesn't know, he knows the scientists who do. So he's a really important leader. I watched them walk that tightrope, and I wish they didn't have to worry about it. These people should be allowed to say what we know that's true, to guide the investments in the science we need and the rapid learning. And every time the president interrupts them or forces them to think three times before they speak, we lose traction on making the kind of progress we really need to.
I know you're not there firsthand like you were for Barack Obama, but from afar, I don't know if you're masochistic enough to watch these White House task force meetings every day or most every day. What do you think is behind the president's misdirection plays here, attacks on the science, embrace of science that has not yet been verified? What do you think motivates this?
No, I'm trying to stay simply. I'm trying to figure out what the best answers are for our country and then articulate them. Why this man would undercut the truth, undercut investments in what we need to know. I don't know. He seems obsessed with himself and his own position. He thinks first about him, and you can't do that now as a leader. You've got to think first about the public you serve. And I don't know. I'd have to be a psychiatrist. I'm a pediatrician.
So one last thing about him, assuming that he were to decide today, if he were to have an epiphany, and I'm going to follow every piece of advice that Anthony Fauci puts in front of me, is it too late to save tens of thousands of lives, or could he turn this thing around?
Oh, no, it's not too late. We have not seen the peak roll through the country yet the way it will. It's going to hit the South, I'm afraid. There's an article today by the dean of the School of Public Health at Harvard about the vulnerability of rural communities. So we need to pull out the stops and reach out to places where the virus is coming. Part of that is strengthening the Medicaid system, the safety net, so that people can get the care they want. Part of it is reaching out to hospitals so they have supplies they want. We have to liberate the stockpiles in the nation. And then in the long run, we've got to move everything we can toward coming up with diagnostic testing, antiviral treatments, and vaccines as fast as we can. It's a war.
Can we come back to Massachusetts for a second? I said in the opening that the public health officials in the state today announced the guidelines. Pretty scary, I think, for a lot of people. Should we need to ration care? And as I mentioned, number one preference, those best chances surviving their illness, additional preference to medical personnel, and in the event of tie scores, younger patients are given priority. Are they on the right track there?
There's been a lot of thought about that. The right track, wrong track, it's a Hobson's choice. It's a tragedy no matter what we decide. But if as I hope does not happen, we run out of those supplies, we've got to have the backs of the doctors and nurses and hospitals that have to make these very tough choices. And just to have everybody do what they think is not as smart as kind of coming together as a state or as a nation and saying, well, tough choices. We have to decide what's the best for us, our whole community.
You know, speaking of local doctors who have to make that decision, you wrote a piece in the New York Times, and your opening line was from a doctor, local doctor. I'm having flashbacks to the Boston Marathon bombing. Who was that doctor, Dr. Berwick?
That was my daughter.
And she's practicing now, right?
She's practicing on the front line, and I remember her calling me that the marathon memory was of a patient being wheeled into the emergency room when she was a very young doctor and bleeding on the floor. They tried to wipe the floor, and the policeman who wheeled her in said, "Don't bother. There's a lot more coming," where that one came from. And this uncertainty, this sense of a wave hit. And she said it was the same thing. We know coronavirus now. We understand how it behaves. And when you see that first case, you just know there's a lot behind it, and you better be ready. And that sense of dread and uncertainty was something she felt. But she goes to work every day and is on that front line. I'm so proud of her, as I am of all the people. It's not just doctors and nurses. It's the person that I see in the grocery store the rare time I go now, or the pharmacist.
We're going to have one on in a minute.
Yeah.
You know, speaking of dread and uncertainty, I want to talk about another piece of the population that I'm sure is feeling it. Here is the Surgeon General, Jerome Adams, just this morning.
And when you look at being black in America, number one, people unfortunately are more likely to be of low socioeconomic status, which makes it harder to social distance. Number two, we know that blacks are more likely to have diabetes, heart disease, lung disease, and I've shared myself personally that I have high blood pressure, that I have heart disease and spent a week in the ICU due to a heart condition, that I actually have asthma and I'm pre-diabetic. And so I represent that legacy of growing up poor and black in America, and I and many black Americans are at higher risk for COVID. It's why we need everyone to do their part to slow the spread.
What prompted those comments from the Surgeon General were reports I'm sure you've seen in the New York Times today. In places like Louisiana and Chicago, 70% of the deaths from coronavirus are African Americans, while they only represent a third of the population. Back home, closer to home, at MGH, they're reporting that 35 to 40% of their coronavirus caseload are Latinos. You probably know only 8 states, only one in New England, Connecticut, actually break down data by race. Is this disparity that I know you've spent a lifetime talking about, writing about, working about, is this just a natural extension of the lack of access, decent access to care that people of color have, or has coronavirus made it even worse, Doctor?
We've been living with these disparities now for decade after decade, and it's time for this country to do something about it. Yeah, coronavirus reveals them, but I could have told you those facts before we knew them, because being black or poor or excluded in this country is a formula for poor health. In many ways, formula for poor education. We haven't committed to equity in this country. And let me say, it's not just access to medical care we're talking about here. It's the conditions of life, the social determinants, because poor housing sets you up for poor outcomes. That's true of coronavirus, and it's true of when coronavirus isn't here.
You know, when a lot of us are not sort of suffering through the moment, whatever tragedy there is of the day, we try to think about the future after coronavirus, and will we have learned any lessons? Will we embrace a more activist government in the wake of a $2.2 trillion stimulus bill, another one to come? Will we change our perspective on investing in public health, or is this a one-and-done kind of thing?
We have to change our leaders, I'll tell you that, in order to get that to happen. But we must. Notice the policies going in the wrong direction like right now. In this administration, there's been a constant weakening of the safety net that we absolutely are relying on right now. In the 2020 budget, the president tried to take $200 billion out of Medicaid. Medicaid's our safety net right now. There's all sorts of attacks on Medicaid, one of which is to block grant Medicaid, shift the funding so that states get a fixed amount of money. Can you imagine what that would be doing to poor states, to all states today? So no, we've got to decide to help the people who need the help, and that's got to be reflected in public policy.
You know that op-ed I mentioned where you start with a quote from your daughter, you end mentioning another doctor, one from Italy, Dr. Robert Stella. Could you briefly tell his story, if you would, Doctor?
I read it in the newspapers. As you know, Italy was just pasted by this pandemic. My heart goes out to that country. And they've been very generous in sharing the lessons they've learned. This doctor was the head of a medical society in his area. They ran out of personal protective equipment. They ran out of masks. And he said, we're out of equipment, but we don't stop. And he went to work, and according to the paper, 2 weeks later, he was dead of coronavirus. People are being heroic today. We shouldn't have to ask them to be that heroic.
Could not agree more. Dr. Donald Berwick, it's good to see you as always. Thanks so much.
Thanks for being there, Jim.